Welcome to the updated Dr. Bernstein podcast. Please check the description for the original sources, and all content is general in nature and should not be considered medical advice. Today, we're going to be diving into Dr. Bernstein's insights on gastroparesis in type 1 diabetes. And we'll be comparing his approach with findings from some recent PubMed research articles. It'll be fascinating to see where they align and maybe where they diverge a bit.
Yeah, it's like we're trying to bridge the gap between, anecdotal experience from Dr. Bernstein's practice and the kind of wider lens of scientific research. So it's a great way to get a more comprehensive view, I think, of this complex condition.
Exactly. And, Dr. Bernstein, he doesn't shy away from, strong opinions. He really emphasizes how often he sees gastroparesis in his type 1 diabetes patients, claiming it's more common than many endocrinologists think.
Yeah, and that's where, having the research alongside his opinions is so helpful. Dr. Bernstein's view is really based heavily on what he observes every day in his practice. And particularly, he's highlighted these blood sugar patterns, unpredictable lows after meals, followed by surprisingly high blood sugars hours later. He sees that as a key indicator.
Yeah, it's like the digestive system is just throwing a wrench into blood sugar control.
Exactly.
He uses this analogy of the stomach being a bit of an on-again, off-again machine, and it ends up, leading to those blood sugar roller coasters for his patients.
And that unpredictable stomach emptying is at the heart of how we understand gastroparesis.
Hmm.
But in terms of how common it actually, I get it. The research paints a slightly more nuanced picture. One large meta-analysis we dug into found a combined prevalence of 9.3% in diabetic patients. And it seems like there are higher rates in women and those with type 2 diabetes.
So more common than some might realize, but maybe not as prevalent as Dr. Bernstein observes within, his specific group of patients that he sees. Now, where it gets really interesting is his take on diagnosing gastroparesis. He's a huge advocate for the RR interval study. He even goes so far as to call it more reliable than the standard gastric emptying study. And he shared this really compelling story about a young patient who was initially misdiagnosed because they only use that standard test.
Yeah, that's interesting. And that's where we see a bit of a divergence. The research we looked at does acknowledge there's a need for more precise diagnostic tools, but it doesn't place the same emphasis on the RR interval study as Dr. Bernstein does. And for those who aren't familiar with it, this test uses your heartbeat patterns to kind of assess how well your stomach is emptying. And it seems like Dr. Bernstein's strong opinion of this test stems from years of correlating those distinctive blood sugar swings with the results of this specific test.
So he's making a connection between those blood sugar roller coasters and what the RR interval study reveals about the vagus nerve, which of course plays a role in both.
Exactly. And while the research we're looking at doesn't specifically delve into that test, it does echo the importance of considering a patient's individual experiences and symptoms. One of the studies highlighted the wireless motility capsule, which is that small capsule you swallow that transmits information about your digestive system. They found it might identify more cases of delayed stomach emptying than the standard test.
So both Dr. Bernstein and the research seem to be saying, hey, let's look at the whole picture here, not just one piece of the puzzle.
Absolutely. And that whole picture approach is crucial when it comes to treatment as well.
Speaking of treatment, Dr. Bernstein, in his typical direct style, gave a pretty stark picture of what it's like to live with severe gastroparesis. We're talking blended food, GERD, frequent vomiting. He really emphasizes how debilitating it can be.
He certainly doesn't sugarcoat it, does he? Thankfully, those severe cases are less common, but it highlights that gastroparesis exists on a spectrum. And that's something the research emphasizes too, the need for treatment to be individualized. But before we get into the specifics of treatment, let's delve a bit deeper into this whole idea of blood sugar control, because that's where things get really tricky for people with type 1 diabetes.
It's like having to manage two really complicated conditions at once, right? You're trying to keep your blood sugar stable, and then gastroparesis just throws a wrench in the works.
Exactly. And Dr. Bernstein really drives this point home in his lecture. He argues that for people with type 1, gastroparesis can actually make it seem like their insulin isn't working properly.
So it's not that the insulin is ineffective per se. It's more about the timing being totally off because of how unpredictable that stomach emptying is.
Precisely, yeah, and this is where it can really become a vicious cycle. Dr. Bernstein talks about how those persistent high blood sugars, if they're not managed effectively, could potentially worsen the gastroparesis itself.
So you have even more delayed stomach emptying because of the high blood sugar. Talk about a double whammy. Makes you wonder what the research says about, managing this tricky balancing act.
Yeah, so While the research doesn't always draw a direct line from high blood sugar to worsening gastroparesis in the short term, there's definitely a general consensus that poorly controlled diabetes, especially over long periods, can damage nerves, including the nerves that affect our digestive system.
So it really underscores Dr. Bernstein's point about the importance of early diagnosis and proactive management, especially for his patients with type 1 diabetes.
Absolutely. And when it comes to management, both Dr. Bernstein and the research, as we've touched on, really emphasize a multidisciplinary approach. And of course, diet modification is a cornerstone of that. Dr. Bernstein, in his lecture, points to a couple of interesting things here. First, he mentions that smaller, more frequent meals can be a lot easier to manage than large ones. Second, paying close attention to the types of foods you're eating is key, as some are digested more slowly than others.
That's so fascinating because he's taking these, general dietary recommendations for gastroparesis and making them hyper-specific for people with type 1 who are already thinking about carb counting and how different foods impact their blood sugar.
Exactly. And while the research does support those dietary strategies, some of the nuances Dr. Bernstein brings up aren't always explicitly studied in those research papers. And I think it just highlights the importance of that really open dialogue between a patient and their healthcare provider.
Yeah, and speaking of that patient-doctor conversation, there's another crucial aspect that Dr. Bernstein emphasizes that I think often gets overlooked, and that's the psychological impact of living with gastroparesis.
Oh, absolutely. He's actually quite candid about how the constant uncertainty and discomfort of those symptoms, not knowing when you might experience nausea or vomiting or abdominal pain, can really take a toll on a person's well-being, potentially even leading to anxiety, depression, social isolation.
It makes sense if you think about it. Imagine never knowing when those symptoms might flare up. It would be incredibly disruptive to your daily life.
Yeah.
It would definitely weigh on you emotionally.
And this isn't just, anecdotal observation. The research backs this up as well. Many studies have looked at the impact of gastroparesis on quality of life, and the findings consistently show a significant decrease in overall well-being for those with the condition.
Yeah, it's a good reminder that we're talking about, real people dealing with this condition, not just a collection of symptoms. So when we think about treatment, it really needs to address that whole picture.
Exactly. And this is where, really exploring those different treatment avenues alongside that open communication between the patient and their doctor is so important. So we've talked about diet, but then there are medications as well. Dr. Bernstein, in his lecture, seemed a bit wary of some commonly prescribed medications. He's specifically mentioned Reglan because of the potential for side effects. He said he tends to favor domperidone, which I thought was interesting because it's actually not FDA approved here in the U.S.
Yeah, it speaks to his willingness to consider options outside the conventional box, always weighing those potential benefits against the risks, of course. Did the research touch on domperidone at all?
It did, yeah. There's some interesting research on its effectiveness, but the studies acknowledge the need for more large-scale trials. And of course, that fact that it's not FDA approved here adds another layer of complexity for patients in the U.S.
Definitely highlights how important it is to have those really open and honest discussions with your doctor about all the potential treatment options.
For sure. And it's not just about medications either. We talked about the psychological toll gastroparesis can take, and that's where I think things like therapy, support groups, even just learning stress reduction techniques can be incredibly helpful.
It's about empowering people to take an active role in managing their condition, both physically and emotionally.
Exactly. And I think the most important thing to remember is what works for one person might not work for another. Gastroparesis is not one size fits all. It requires that personalized approach, that partnership between the patient and their healthcare provider.
So as we kind of wrap up this deep dive into the world of gastroparesis, what would you say is the most crucial takeaway for our listeners?
That's a good question. I think if there's one key message here, it's that knowledge is power. The more you understand about gastroparesis, the symptoms, the diagnostic process, the treatment options, the potential impact it can have on your life, the better equipped you are to advocate for yourself and to work with your healthcare team to find the best possible management plan.
And don't be afraid to ask questions, explore different options, and really speak up about what you're experiencing.
Absolutely. You are your own best advocate. And remember, even though gastroparesis can present some significant challenges, there is hope, there is support, and there are definitely effective ways to manage this condition and live a full and meaningful life.
This has been an incredibly insightful conversation. Thank you so much for, walking us through those research articles and for helping us bridge that gap between Dr. Bernstein's, insights and kind of that wider scientific perspective.
Oh, it was my pleasure. Always happy to dive into a topic like this.
And for our listeners, if you're looking for more information on gastroparesis, we'll be sure to link to those PubMed articles in the show notes. You can also find some really helpful resources on the International Foundation for Gastrointestinal Disorders website, as well as the American Gastroenterological Association's website. Remember to like and subscribe, and thank you for listening.